James Patterson, are you ready? All right, we're counting on you. Good evening, everybody. Welcome to the board meeting. It's a review meeting. At 6:30, we have two presentations. We have to make our presentation first on our social emotional learning. We have our team here, and then from there we have an agenda review at 6:30. We have to have a brief hearing on the code of conduct. I'll tell you, board members and community, there were very few changes because it's so comprehensive. But at 7 o'clock, we need to have a full public hearing on the budget and the budget only. And Becky and Julie are here to do that. After that, there's no need for an executive session. I have just a few comments and we'll move forward. Without any further ado, Rob Bilson, can you hear us?
Loud and clear. Thank you.
Thank you, Rob.
You're welcome.
Thanks, Rob. And is Paul on it yet, Ray, or no? Paul has not joined us. And Mr. Bass will be joining us momentarily. Want to believe it was you, Mr. Petrozzi. We had a very good presentation by Rick and team with respect to the academic uses of our ARP money. And tonight, to round that out, you've heard about our capital projects uses of that money. Tonight, to round it out in a small way, we've got our social emotional team a part of it, because that team is huge and growing. And I just want to say to the board and the community, something that you allowed us to do is you showed the value of our 17 social workers and our other supportive team members, because we can't afford to work without them. This is the other portion of our kids' lives that really needs it, and that's the social emotional side. I know he probably won't speak, but before Stan and Kevin and Jamie and the other young lady come and speak, Stacy, I want to give Mr. Marino, who's here, Rocco, I wanted to give you a great deal of thanks, because he has kept welcoming more and more team members to his school. And I think that he knows that it's only a help to bond, but he also recognizes that the support team doesn't just work for bond. But he's been more than accommodating to say, bring them over to bond, we'll use them, we'll house them, we'll build it. With that, I'd like Stan to do the introduction and talk. Good afternoon, Mr. Bass. It's good to see you.
Good evening, everyone. Mr. Laurie, members of the board, thank you for the opportunity to introduce Mr. Burgess and members of our family support team. For a number of years, our district has partnered with agencies and organizations within our community to extend the services beyond our schools. Mr. Marino established our wellness committee in 2006 that has grown to extensive lengths. That program, along with the addition of our social workers within recent years, has called for us as a district to take a look at the way in which we're offering these services within district. Not just our social workers with that program that has expanded. We have our school counselors, we have our school psychologists, our PSAs, and other team members within the building that provide these social emotional learning opportunities and these learning programs for our staff and our community members. This evening, Mr. Burgess is going to highlight some of our intentional work of our social workers and some of our next steps for our Family Resource Center.
Welcome, Kevin. I think, and we have Jamie Schmidt here, who's a social worker on our team, but I think in a short time we've received nothing but praise and thanks for really, the social workers were doing good work, but helping with direction, questions. I know I've offloaded many community resources onto you and will continue to offload the community resources that come to me for you to handle and to distribute as when and where appropriate to the social workers. So welcome to the team, and make it brief, and you'll get many more kudos. Thank you.
Thank you. So I'm going to start I'm going to start by talking about our Family Resource Center and our social work program. As Mr. Wooten said earlier, we have expanded the social workers. Mr. Laurie touched on it. We now have 17 social workers in the district, plus myself. This is a breakdown of the full-time equivalents and where they are at each school. So every school is represented in some way with a social worker. Some schools have more than others. It's based on need. But every school has a social work presence, which is a great thing, because I'm going to go into what those social workers do in the buildings as well.
Just for reference, in 2018, the number on that screen was 0. 0. And we're up to 17 plus. That's the value that I think the social workers have. And I don't want to speak for Rocco, but I know he uses his team and other principals do in a multitude of ways. They're invaluable. Thank you, Kevin.
So one of the things the social workers did last summer, and again, we updated it over spring break this year, is they created the Mental Health and Community Resource Guide. That can be found on our school district website, and over the summer will be added to a newly formed Family Resource Center website. What that Community Resource Guide does is it provides our families and our students with a document. I think it's 23 pages, and it gives all the resources in Niagara County for the following categories. So if you need mental health for children or adults, so right, our parents might need mental health services, our children might need mental health services, it's identified there. If you need to know who your school social worker is, it's identified there. Emergency food pantries all over the city, who qualifies and what those food pantries provide and when they provide it, it's on there. Health insurance resources were added, transportation resources, family support programs, and we're getting to meet with more agencies and adding more programs to that as well. We added over spring break addiction treatment and prevention services for children and adults. Housing shelters are on there, clothing assistance is on there, primary care providers are on there, and then over spring break, we added care management agencies as well. So what I consider these things are social determinant of health needs. They're not necessarily related to education, but they affect education. So if a student or the student's family doesn't have these needs being met, say they have health insurance, lack of health insurance, or they don't have a safe place to live, or they don't have food to eat, they're not going to be worried about how they're going to do on their tests the next day, or getting their kids to school on time. So having a resource where these parents can go, or these students can go, is paramount. Some people don't like to ask for help. Now, if they do like to ask for help, our newly formed Family Resource Center is the place to go, and we're going to talk about that next.
So Kevin, you mentioned the social determinants of health. I think the social determinants of health equal the social determinants of education. Mm-hmm. So those underpinnings and backbone of a hospital are the same for kids in schools.
Yep. So we've redesigned our Family Resource Center this year in March of 2024. We got to work on kind of having a vision for what the Family Resource Center is going to look like to better meet the needs of the social workers, the counselors, the teachers, and the families that they serve. One of the things that we found is that in all the schools, social workers were doing different things. Some social workers knew about these resources, some knew about other resources. Nobody was really on the same page and utilizing all the same resources, the same referral processes. It was kind of a mixed bag. Everybody was working on the same type of stuff, but they weren't all doing it in the same way. So one of the things that we did is, as the Family Resource Center, is we looked at we decided, we should focus on a finite number of areas and get really, really good at them and find resources for them and make it so that our families can access those resources, our teachers can refer, our students can get the help that they need, our social workers know where to go. So the Family Resource Center is now the hub for those resources. So we went out and we made connections with community-based organizations who can assist families in all of these identified areas, and then we kind of got backdoor referral processes established with some of these agencies. So typically, if we do a referral, say, for care management, or we send somebody to a food pantry, that doesn't always pan out. So the care management agency might get the referral, they might pass it off to somebody else. By the time they call the family member, either that need has already been met, or the family member doesn't have a phone number anymore. What we did is we established these relationships where that agency is willing to come into Boniva Bond at the Family Resource Center, or Jamie Schmidt over here, who heads up the Family Resource Center. She has that relationship where she can reach directly out to somebody at that agency through their cell phone number and get a phone call to the family same day, next day, have them come in or go to the school and meet the family member there. It's a much faster way to get these families connected, because if you don't connect them when they're in need, a lot of times you lose that momentum. So that's what the Family Resource Center is planning to do, and we've piloted it the last couple of months here with the social workers, and we will roll it out next school year to all of the staff and counselors and psychologists and teachers in the school district once we've worked out all the kinks. But we streamline a referral pathway, so we have a referral form that I'll show you where they would fill it out, and like I said, it would go to Jamie or Stacy, and we kind of delegate to who handles that need, and then we would get that need met in a more expedited fashion. We have a workflow identified, so if somebody gives us a referral for a specific need, I can tell you exactly what steps the Family Resource Center is going to take to meet that need. And then we have a tracking sheet, a spreadsheet created to track where we are in the referral. So if a teacher, this happened today, says, hey, this student needed a primary care physician, do you know where we are in that process? We go on the tracking sheet and we can see where in the process we are. And I can say, oh yeah, we got this person linked with insurance, we're waiting for insurance to kick in, and then we're gonna make sure they get that primary care appointment. So everything's being tracked and it's streamlined. So what we want to have happen is all of these social determinant of health needs to go district-wide through the Family Resource Center so that our social workers can focus more on the social and emotional individual and group interventions with the students, instead of being on the phone with agencies and trying to run around and figure out how to get these needs met. They can actually spend their time, really making an impact in the student's life, in their school day, and hopefully getting them back on track to where they need to be. These are the 10 areas that the Family Resource Center can assist with. So we have emergency food, we have clothing, we have emergency housing, we have care management, substance abuse, mental health services, family support services. Our district focused on families program, furniture, household items, and hygiene supplies, and then health insurance for the student or the family. So all 10 of these areas are very important. I'm not sure that any one is more important than the other, but if a family or a student has a need in this area, it's going to affect how they perform in their educational setting. So since we returned from spring break on April 9th, this is through last Friday, we've assisted in 36 different areas. You can see the breakdown of what need the family or the student had addressed. So we've addressed 36 needs in the Family Resource Center since April 9th.
The tracking is really good, Kevin, and what I would ask for is at the end of each, you by the month?
Yeah.
Can you send me so I can let the board know on the 10, so what I'd like to establish is the board knows there are 10 categories that we're servicing out of our Family Resource Center. At the end of the month, I would just like to know the monthly total and then the yearly total.
Sure.
Can that be facilitated?
Yep, absolutely.
And then I'll share that out with the board and the public.
Okay.
Because I think it's very telling of who we are. Not excuses. I'm not making excuses. I'm just setting the baseline of where our social determinants of education and health are. So that's what I would request. Mr. Earl?
I see family support and mental health services are the two highest by far. Does the type of calls you've had so far, do those two tend to overlap?
So family support might be things more like parenting education, where mental health is more often than not individual counseling for a student. So the family support typically is for the parent, where the mental health counseling is more for the student. But yeah, we've had families where we've done both. So the parent wanted help with parenting resources or parenting education, but because they were struggling with the child, so then the child was also referred for the individual or the group mental health counseling.
I just want to say something about the data, so it's not like we've been doing these. We just haven't been tracking these this way. So, we've been doing these. I don't want anybody to think that we're just starting these with, but B, this is the way we'll track them. And what I really like that you did and are saying is that you picked 10 of the 10 hot areas. They cover a lot. Now we can demonstrate on a monthly basis exactly what the trends look like. So I want to make clear, we've always been doing them, but our tracking system is what's been improved upon. And the flow chart, I think, is a great idea because we can find out where in the system Johnny's caught.
I just read, it looks like you standardized everything for every school, correct?
So that
Yeah.
right now,
And
we're
it's-
piloting it,
yeah.
but that is the plan going into next
So in
year.
other words, if a social worker gets transferred from 79 to GJ Mann, it's going to be the same procedure, same
You got
forms
it.
and
Yep.
everything else.
Everything should come through the Family Resource
Yeah,
Center,
okay, good.
district-wide.
Yeah.
That's the clearinghouse, Mr.
Yeah.
Valaro. It's a good, you picked up on it, it's good. That way, every school, no school says, they don't do anything, you know. It all goes to the clearinghouse, they disseminate it to the right person and track that it gets done.
Yep, and Jamie can tell you, I won't have her come up here because I think she's a little nervous.
No,
But,
she gotta come up.
I mean, she's worked with, I think, every single school so far, and since April 9th. Every school is sending us referrals, every school's making phone calls. Right now, it's just out to the counselors and the social workers, but once we've worked out the kinks, next school year, it will be going out to all of the teachers and principals and administration.
But Mr. Valaro, you're right. We've standardized it, we're tracking it, we're doing it on a very consistent basis across the district. Jamie's not shy, Stacy Rowe is, Kevin, I didn't tell you that. Go ahead.
By the way, this is Jamie Schmidt and Stacy Rowe. They're two of the counterparts associated with the Family Resource Center. When I first started here on March 3rd, I spent my first 2 weeks, I went to every school, and I met with all the social workers. And I got an idea of what it is that the social workers in the schools were doing. And I can tell you that it varied by building. There was not a standard, this is what social workers do district-wide. This is not a comprehensive list of what they do. This is the most common things that the social workers were doing. So not every social worker is doing all of these things, but most of them are doing most of these things. So crisis intervention, one-on-one counseling, group counseling, going to the START meetings, acting as a McKinney-Vento liaison, behavioral management when students are in crisis, restorative justice circles, going into classrooms to conduct social skill building, and then referrals for needs related to social determinants of health, and that is one of the things that we've worked on streamlining. Periodic home visits, there's the clothes closets and the food pantries, coordinating with outside agencies and programming. Again, that will mostly come through the Family Resource Center now. Attending CSE meetings, building bullying reduction groups, and conflict mediation. So social workers, you can see they do a lot of different things, wear a lot of different hats, but they're all very important stuff. So going into next year, we want to continue to have students and families in the district refer to the Family Resource Center. We want to continue to build this momentum for social determinant of health needs, continue to work as the liaisons for the McKinney-Vento program and other building-based programs. We do want to standardize and have all the social workers attend all their START meetings to get student referrals, because what we want to have happen in a very slow rollout is have the social workers doing more of the one-on-one counseling. So they're going to be doing screening, all referred students for anxiety, depression, adjustment disorder, behavioral concerns, or anger issues, and they'll be providing more of that individual and group counseling that kind of got pushed off while they were doing a lot of the social determinant of health stuff. So that social determinant of health stuff will come through the Family Resource Center, so our social workers can work more with the kids one-on-one and in small group settings. Assessing students for psychological counseling services and identifying it appropriately in an IEP or a 504. Intervening with student crises as they arise. This could be related to school issues or home life, right? So if something's going on at home, it's going to affect you in the classroom. And then appropriately documenting and standardizing documenting for all the session encounters for individual or group counseling. And then something that we started about a month ago is I meet with the social workers biweekly for clinical supervision, where they will bring cases to discuss. If they have a student that's having a mental health issue or an emotional issue and they're stuck, we work with each other, we brainstorm ideas. I use my experience that I've had to kind of guide them, and this also helps them gain, because of my level of licensure, helps them gain hours towards expanding their level of licensure as well. So we meet every other Friday to do those types of things. We'll also bring in other organizations who have in-services or trainings. I have one scheduled with Roswell on the 17th to talk about vaping in youth and interventions and strategies that are available for that, and some of the things that Roswell can do or provide for us in the school district. So we'll continue to do that as a group setting to get everybody on the same page. Again, like I said before, it used to be some social workers knew some things and other social workers knew other things. Now everybody's going to be on the same page. Next steps, we're going to develop processes for identifying students and securing parental consent, referring and evaluating and qualifying these students for psychological counseling. Those processes will be worked out between May and June of this year. Then in the summer, we'll develop training materials and protocols. At the end of the summer, beginning of the school year, we'll train all the applicable staff on the processes, and then I'll work on training the social workers on how to document appropriately, and then we'll begin to qualify students, hopefully in an IEP review meeting, and providing these services and monitoring for compliance. I do have some attachments. I want to show you, this is really cool. I want to show you the Family Resource Center referral form that we created this year.
Good.
By this year, I mean like a month ago. Let me see. That should be getting pulled up now. So you can see here on the referral form, and right now this is just the social workers and counselors, but we will be rolling it out to the whole district next year. There's the 10 areas. They're check boxes, super easy to fill out. They can check more than one box. They give us a little reason for the referral. They can electronically sign the form, and then they send that right to Jamie, and she gets on it same day or next day. And we get those families linked with what they need. We have the workflow. So you can see here all 10 areas are identified, and then exactly what we're going to do with each of those things when we get a referral. So this is mostly, you see Jamie's name all over this because she's the point person here. This is what we're going to do for all 10 of those areas. And then the really neat document I want to show and point out is our updated community mental health and community resource guide. So I think this is up to like 20-something pages now, but you can see here all of those categories that we talked about earlier in the PowerPoint, and all of these agencies will serve Niagara County. We don't want to send people to Buffalo because we know they're not going to go. So these are all the agencies that will serve people in Niagara County, and who you can call, what they do, and when they provide their services and how to get in touch with them. Because not everybody likes to ask for help, but now they can look at it themselves and decide what they need.
Kevin, it's really good, and I think Mr. Velardo really touched on it too. We've streamlined, we're going to be holding accountability, we're going to be on the same page in every building, we have a common referral form, and I think that as much as we love the website, I think I want to make sure that we create a couple of hard copy versions of this document to be available at schools for those parents that just need a quick resource guide, because everybody's not going to jump on the internet. And I also think that we need to promulgate this through doctors' offices, pediatricians, et cetera, and I think we should leave them with some of the hard copy resources. It's very comprehensive, and I agree with you. If they don't have it at their fingertips, they're not going to know it exists and not be able to use it, so you've comprehensively put that together.
Yep.
So it's been
And
really
sometimes
well.
people don't know where to start or what to do. If they want to reach out to the Family Resource Center, that's what they're there for.
That's right, that's what that center is there for. Jamie, you've got to say something. Come on up, say hello. I want the board to meet you. This is Jamie Schmidt. Mr. Corella, in securing the grant, had a lot to do with hiring Jamie and starting this, and now Kevin and the team are taking it to a new level. Don't put you on the spot. Anything to add?
What was that?
I'm not putting you on the spot, but what do you have to add?
Do I have anything to add? Sorry. No, I think the progression with Kevin, when I was hired, it had a whole different look with Bessel when I was primarily the liaison for those mental health services. It's been really exciting to be able to offer more to families, especially at Boliva Bond. You know, we do our welcome wagons, we have a lot of parent meetings, so to have that resource to give to people, hey, even if you don't feel comfortable telling us, this is what we have to offer. These are the real people that you contact, not a 1-800 number, not
Right.
sitting on hold with somebody.
Right.
I can do it for you. You can do it yourself. One of the things I'm proudest of is our food pantry that we have for the whole district. So when we get a call or an email on a Saturday, hey, this kid had a death in the family, they don't have any resources, we're waiting on food stamps, we can pack a box, Stacy can pack a box of clothes, whatever they need, drop it off, we're getting them those real tangible things, and they're engaging with us more. So I just think, you know, like we said, those social determinants of health are a big thing for, I think, why our kids are struggling or not coming to school or not getting those grades. So to be able to help that has been really, really cool to be a part of.
Great job, Jamie. Do you have questions? Well, let's call her up. Come on up. That's, Mrs. Dunn cued you in. Can you?
People are telling me that their kids going to the clothes closet and they're coming out with not just anything, they're coming out with good quality clothing. And that brings joy to me because a lot of people, a lot of kids, they're ashamed to say that their families can't provide clothing for them. So it brings joy to me that these people are telling me that our programs are working. They appreciate their
Hit the mic, Claire.
going to the clothes closet.
Right.
So I appreciate it.
You've dispelled that that stigma or that myth about the food pantry and the clothes closet. Stacy's taken it to a new level. Her role is really in the McKinney-Vento dollars that we've talked about for homeless. But hiring her, we knew that would just be our way to get her to do 8,000 other things. Would you take a moment to talk about the clothes closets?
Thank you very much. My name is Stacey Rowe. I'm part of the District Family Resource Center. I work with Mr. Krella and Dr. Chaudhry and Sharita under the McKinney-Vento, and in addition to that, I build closets. I build and support closets in all of our schools. There were some closets before. I built Cataract's closet, and going forward now, I'm proud to say I'm supporting the closets that are already established, and we now have working functional closets in all of our schools, and DeFrancesco building is going to happen over the summer. After that's done, every school in our district will have working functional clothing closets available to all students, no matter their program participation, during school hours, for spills and accidents, or home clothing can be packed for home.
Thanks, Stacy. And I know something that you and Mr. Marino have been pushing myself and Mr. Smeal on at Bond at the Family Support Center is to bring in a washer and dryer system. I know that's going to require Mr. Smeal to do some additional work, but he'll get it done. I know that's been an ask from your principal and from you. You see that as a need.
Absolutely. There's so much to say. I'm in five-year plans. I have 10-year plans. A washer and dryer facility that our students can have access to at the upper levels. Starting at Bond would be fine, but allowing them to have access to washer and dryers would be a game changer for a lot of our students and families. Coming to school with clean clothes, having a safe place to wash their clothes, and having students help work the clothes, student participation, having everybody involved. I have so many plans. I just have so many plans because the need is out there. It's so great, and it's something we can do. This is something we can do.
Yeah, thank you. Go ahead, Russ.
Yes.
Couple questions and then one comment. And I know, depending on the need, but when you get the application, how soon could the family or child expect? I mean, different things obviously are more important.
As far as clothes, that's one of my favorite questions, actually. One of my favorite parts of this whole thing is the immediate and consistent response that we are able to offer our students and families and the social workers and liaisons. The clothing closets are there, fully stocked for day-to-day use, but if there's something in addition, I can be contacted through any of the liaisons. Items can be packed and shipped that day, depending on the situation. If there's an emergency, a house fire, a transition, if something's going on, it just depends. My schedule is very flexible. McKinney-Vento is my priority, and then after that, if I get a phone call from the high school that a student needs an air mattress, or if somebody's in transition, I go and I pack, I find, I do, and I ship and I bring, and I have very good relationships with all of our schools, social workers and guidance counselors. I look forward to continuing that, and they know that they have a safe, reliable source within myself and now the team to get those needs met quickly and consistently so our social workers and our kids can get back to do what they're supposed to be doing, learning.
So that's really instantaneous. That's great. Second question.
Yes.
Somebody asks for, has a need. Is there any back checking after to say, hey, are you okay?
Would you let, there you go. Jamie?
That would be where I come in. So like, for example, today I got a call. There was a family meeting at Cataract because I'm mobile as well. I'm able to go. It was a family who needed care coordination because we've worked with Kevin to build those relationships. Instead of having to go through a formal referral, which takes about 2 weeks, I can put that referral in, talk to a real person. Hey, I'm going to reach out to this family tomorrow. So tomorrow when I go in, I will call the family and I will follow up. So that really is my sole job, is to make these connections and then follow up to make sure they're still working. Hey, we linked you for mental health counseling. Is this still continuing? Because we have to, things are changing all the time. There's turnover, people are leaving, and it's nice when we have those relationships that a family feels comfortable to call and say, hey, we were seeing this counselor for 2 months, they disappeared. Can you hook me up with somebody else? So that's with that checking in and making sure that there's never a lapse in what they need.
One comment, the clothes closet, contact me. Are you in need of clothes? Or are you in need of clothes?
Always, yes.
Okay.
I do have yes. The
Okay,
short answer is yes.
we'll have a conversation.
Perfect, thank you very much.
Okay, you got it, but we have to be specific in what we're looking for.
Yes,
So you and I will work that out, but I can help you in my stores.
wonderful, thank you, thank you.
The community's been great too, right, Stacy?
Oh my gosh, the outpour, well, first it really started with the teachers and the staff. Once they saw the small closets that, simultaneously when I had Cataract started, Gaskill had started, LaSalle had started, and everything started really small. Then once the staff realized what that can do, a quick wash, a quick change, you don't have to call the parent, there's no waiting. It grew and grew, and they started bringing in their items. And now, when I go to the schools, it's great because all the moms and the teachers that are spring cleaning, I put it on all the social media that I can and out there to, I need kids' clothes, and I'm specific, and I have drop-offs, and I have really good contacts in school email. So I do have, the process is almost perfected. It will get there, but it's great, and I do have the supply, and the response is even more than I could ever have imagined. And I'm really proud of it, and thank you for feedback. And it's just great to hear. Thank you very much.
Yeah.
Thanks. And hygiene supplies too.
So I just in closing, did you have a question, Nick?
Yeah, I just have a couple of comments. I'm glad, Stacy, you've come out of your shell. But I really appreciate it. But I stopped in the CEC, periodically I've stopped in there, and you wouldn't believe the supplies that Stacy has in her room. In fact, we may have to think about expanding that because she's doing such a great job in procuring clothing and other health supplies and stuff like that. So she's doing a great job. I want to commend you on it. Thank you very much.
Thank you very much.
In conclusion, I just wanted to summarize this. So for those that are wondering, what did we do with our social emotional dollars in ARP? This is what we've built. And Rick did the academic part, this team and others are doing the social emotional part. And it's the digging, we're talking about some tangible things like clothes and food, but there are all the mental health supports and programs that will now go, and it's been a relief to me. I get a lot of outreach. Would you like this program or that program? I am referring those directly to the Family Support Center. So they act as my vetting and clearinghouse, and if they don't feel it's worthy or needed, whatever, they decide and let me know. If they do, they schedule the program. So it's been a nice way to communicate back to the agencies and vendors. The other comment that I really like is you focused on 10 and you were strategic in those 10. There's probably 10 more, but let's focus and let's get good at 10. And then as we see the need arise and do a needs assessment, we may add 11 and 12. Or you may remove one that has 2 instances all year and categorize it into something else. So the point, yeah.
Are these services available to non-student families? Or are we with just student families right now?
Right now, we're just serving district families.
Right.
District, okay.
And the reason being is the funding sources to get all this stuff going comes from district families. Now, you're looking at 20 people here who have all good hearts. If there was a family that wasn't a district family, There's nothing to preclude them from saying, hey, let me give you a number, let me give you the handbook. Yeah, so I want to be clear that the money was gone to the district families. However, they have permission to, use the referral ability.
One more thing, in addition to that comment, I've also, since this has been rolling out, other districts,
Yep.
the connections that I've spoken to, other liaisons in districts, we bounced ideas off of each other. We have questions, we can help. We've had a student that is moving and transitioning with McKinney-Bent. It's just great to have those connections to keep those flowing. So again, it's quick, immediate response for the student. So it's really awesome.
I'll conclude by saying we can have all the nice plans, all the nice flow charts, all the nice referral forms. If we don't have people working the program with heart and compassion and care and empathy, it doesn't work. Those are just nice flow charts, plans, and everything else. It's the heart and the empathy of the social workers, the counselors, the family support team that makes it work. Or else they're just really nice plans that we could turn them in and say, we did this. But it's the heart of the people, and to the counselors and social workers and all the team, the family support team, I say thank you. Again, I want to thank Rocco, and I'm sure he's here because he's the house. He is the landlord at Bond of the hub, right? Right, Rocco? That's kind of how you're the landlord of the hub, and I know he gives them great support. And I've said it unabashedly because Bond, and not that other schools don't, but Dorothy Brundage in particular, I want to call her out, no offense to the other administrators. She has a tremendous outreach of community support. She is by far our leader as a district in that community support outreach. So she'll call me or email me tomorrow and get mad that I said that, and I don't mean to offend the other administrators, but nobody brings in resources like Dorothy Brundage. I will say that in front of everybody. You guys agree, right? You see it, Rocco?
100%.
Yeah, so thank you very much. Great job.
Thank you.
If we can pull up the agenda for, I know, I'm trying to, everybody's got to raise their game. But Dorothy's exceptional. That is her, I mean, everybody has skills. Rocco, I'm not sure, but you have some, your skills. Every administrator brings different skills, right? Yeah. No, everybody does. I mean, honestly, because he's here, Rocco's early use of data in the dashboard was Rocco, are you listening? Your early use of the data dashboard was the one that kind of drove Rick and the team to use it going forward. That's it for you. Yeah, you're welcome. We have an agenda, first two meetings tonight, 6:30. Here's what this looks like. Pledge, call to order, Ms. Dunn, the prayer. Then the code of conduct, I have about a 2-slide PowerPoint. Maria will jump in. And then if there's any comment, at 7 o'clock, we'll call the order and roll call. We don't need to go through those exercises again. Judy will just do because we've already done them once. And then Becky will take over with Julie. That's for tonight, 6:30 and 7. Ray, thank you, Ray. Ray, if you'd go to the next Thursday, the 16th, it is a public meeting. You asked for and you will receive. The mayor cannot attend. The city administrator's coming, the police chief, and the fire chief. And I believe, Mr. Velardo, it was you who requested that. They are coming for just some commentary, of course, some thanks, and any questions that you may have for the city, the police chief, or the fire chief. We are moving really well through capital projects. You need an update. As a matter of fact, the C word, the change, CO word came up, and Russ was visited. So they're going to show you a few pictures of a few small change orders that Russ and the team reviewed. So we got to get back to that process because we're working on our $29 million capital project. Moving ahead, your question, Ray? Earl?
Aren't our change orders like under 10 for the project?
Oh, we're really low, Earl. I don't.
No, I mean just
the number?
actual change orders.
How many? What's the number at? I think it was 7. 6. 5 as of yet. 5. Not bad, and they're not big money. And you know what? With a few exceptions, Mr. Bass, with the exception of the secured vestibules, we've ripped open, we've ripped the Gaskill and LaSalle air conditioning open. So I'm thinking, and Earl's not here, but I'm thinking, we're doing okay. We're doing okay.
Especially for those old buildings and they're drilling through, I was pleasantly surprised.
We're going well. As you move forth, here are the resolutions for next week. Thank you, Ray. You're right on the mark. Minutes and transfer. There are no bids this month. There will be some bids next month. I'll have Maria come up and talk about the certificated and classified staff, your usual business. Then we go into the resolutions, members of the board. Let me take some time and be a little bit more didactic with these resolutions in the next 20 minutes and ask you to ask me questions if you have any. And of course, I'm scrambling for my form, and here it is. 601, I believe this is our last grant to be approved. It is $289,000 to help pay for our universal pre-K. It's a $289,000 grant. You know, we have about 440 fourth graders and about 250 4-year-olds and 250 3-year-olds. We're now accepting some of the money. This is the school board. This is small cities. Let me be very clear about this. This is the payment of the annual dues. This is not for litigation. This is not for litigation. The reason we're doing this now is because if we pay the dues before July 1st, we get $900 savings. The dues to belong to this organization are $10,800. So I'm advocating that we continue to join the organization and pay it now and go forward. Yep.
Have you heard any more word on the progress of this litigation?
No, we have
Well, we
some-
had the litigation, we're waiting for the judge to make a ruling on this,
Correct.
is that correct?
Correct, Nick. Yep. We're waiting for the redress. I think that's the proper legal term.
And there's no time on it?
No,
They didn't give us
sir.
a date or anything else?
No, sir. We're waiting for the redress, and our small city attorneys are pushing them. And, you know, I think it would be time, maybe in June or soon after, to get an update on that
Yeah.
directly from our attorneys.
Yeah, because it's,
Yeah.
I mean, this has been going on for 10 years, if not longer.
13.
13?
And this is not, even though he consults, this is not in the Massaro Rossetti bailiwick. They do
If
consult.
Rossetti was handling, he would have had the money 11 years ago. but
Even
that's beside
Rossetti
the
couldn't
point.
get this one. Angelo, I'm going to defend you for once. I'm going to defend you for once. Even Rossetti can't move the state that fast.
Yeah, so, I mean, actually, we won the case, is what I'm trying to get
We
at.
did.
We won the case, we're just waiting for the judge to come out with the ruling.
And then the legislator and how to distribute the money.
Yeah.
But let's have those attorneys present to you.
And what was that figure, a ballpark that we were looking at again?
Well, it's funny that you ask, Mr. Bass. I was going to do this during the budget presentation, but if the state would have followed their formula, followed the foundation aid formula from the time that the lawsuit started, we would be owed $64.5 million. $64.5 million is the figure. We just looked at this week. I did not anticipate that. I did not know you were going to ask that, but it is at the top of my list. I was going to do it during the budget. That's if the state followed the formula, $64.5 million would be in this district. This is just our district. They didn't. That's what we're fighting for. Now, I hope, I hope we're getting every dollar, Mr. Velardo, but that's what's in question.
Mark?
Yeah.
I'm sorry, done, Nick?
You also go for the interest on the money that we've been in.
Yeah, like they do if you're late. Mark, question. This is their formula, correct?
This formula was created by the New York State government and education. Yeah, by the governor.
So it's their
2007.
formula, which they are deliberately not following. I guess
Correct.
That's a good, okay.
Correct. And remember last year, I know you'll know this from the budget, we got 13.4 million, right, Becky? This year we got 4 million because I didn't know you could create your own formula if you wanted to. They changed it and said, you know what? We're going to ignore the formula and use CPI. We're going to throw out the highest and the lowest, and we'll use the 8 years in between out of 10 years. All of a sudden that became the formula. Don't know where that came from, as I say sarcastically. So that's what we're fighting against. But to Mr. Bass's point, 64.5 million if they would have followed the formula. And the formula is based on, it's 42 pages long, and it's based on a lot of factors, but poverty, needs, et cetera, factor into that. Judy always needs more election inspectors. I think there are 2 more she's asking you to approve. Judy is doing a fine job. The election is moving on perfectly. And remember, next year, Judy is going to work with the high school to make elections inspectors a pathway for, I think we're going to start with seniors. Judy is going to work with the high school team, and we're going to have our seniors, our 18-year-old seniors, become elections inspectors, get trained, and the goal would be that they would be ready, between the county and Judy teaching the class, be ready for the presidential election in November. That's our goal, Jude.
That's our goal. I'm very excited about it.
Yeah, we're going to start with 18-year-olds first at the high school, and part of civics, people are teaching civics. I think that's a wonderful civics lesson. 604, this is a payment to Niagara County Community College. It's not coming out of your district budget. It's coming out of the grant. This is a payment for $181,000. We have to get this approved because the 11th graders will start taking courses, college courses this summer. This allows us to pay NCCC this summer for the college courses, God bless you, for industrial manufacturing. 605 is, I'm going to ask Maria to speak on this quickly. This is for our TPA services for benefits. It's a $5,000 contract, Maria? And we have to re-up this every 3 years. Would you like to address it?
Can you hear me? Yeah, okay. So this is M&T. They're now known as Gallagher Benefit Services, but this is our broker consultant contract. And as everybody knows, our broker consultant hires our TPA, our third-party benefits administrator. So this resolution and this contract are for Gallagher, and it also outlines how Gallagher hires our TPA.
Total cost of this contract per year?
For the broker and consultant is $5,000.
$5,000. It's a $5,000 contract to perform those services.
Right.
And anything else that Maria and Becky direct.
Right. And the TPA, though, is more, but that's in here.
Right.
Yeah,
Right.
the TPA.
606. This is, again, I asked Maria, we have more students who require nursing services.
Correct.
And we have exhausted, both figuratively and literally, our nursing staff. Exhausted them. Maria, what is this?
This is, we have students who require daily transportation escorts. So this is for nurses on our buses. And it's also to help us cover some long-term absences that we're experiencing in our clinics with the nurses that we do have, our district employees. We have hired this year 2 additional part-time nurses, but the need has far exceeded our ability to cover field trips, sporting events, away trips when students go away. So we've had to contract with this agency to help us cover those absences.
So we right now, and I think Mr. Bass has some firsthand experience, if I'm not mistaken. We now have 14 students this year, I think it's 14, who require a nurse on every bus run with them. And I think, and let me tell you this, and I think, Earl, not to put you on the spot or to divulge any HIPAA, but I think in 2 cases, medical emergencies came up on the bus when, of course, ambulance and fire can get there, but the nurse is also on the bus and was able to administer the proper treatment and drug, which I'm not going to get into, while the student was having their episode on the bus. I think you were on a call, Earl, in your job. So was the nurse there? Yes. And I would hope that you would testify that it's worthwhile.
Yeah, I actually didn't realize that we had a bus dedicated to our students and their medical needs. And when we rolled up on the scene, and considering what was going on. Not only was she present, she also advocated for that student. And I was presently surprised that that was something that we offered, and I didn't realize that. But it is definitely worth
I think so
worth
too.
the investment.
I'm sorry you had to see that,
Oh, please.
but I'm glad that you understand and the board understands now that we do it. And don't forget, those students take field trips, they travel, they go different places. 7 of them are in high school. Our kids are, we have to do it at all times. It's not just home and back. We have kids staying for after-school programs, and somebody's got to be there at 5 o'clock. So our nurses, literally and figuratively, are exhausted. On the transports in Mr. Valero and now, we've condensed them to an elementary run and a high school run. And that's, I believe those are the only students on the bus.
Yeah.
So we had to take 2 drivers. This took a lot of coordination and planning. Now, I know you know there's a bus driver issue, and there still is, but now, because these students are entitled and need this service, we took 2 more drivers out of the pool and assigned them that way. And then we have to make sure these kids are on time, et cetera, et cetera. And in 2 cases, we've had great saves by our nurses. But the needs are growing and growing and growing. And we can't out-hire this. And I know Maria works very closely with CSEA to make sure that they're in good standing with what she's proposing. Correct, Maria?
That's correct. We're not supplanting CSEA with this. We're really just trying to supplement.
Right.
Okay, I'm a little confused. There's 8 people on the bus, there's 1 nurse?
Well, there
Or
could
8
be
nurses?
9 or 10. There's 7 students, a nurse, a driver, and an aide.
Right, so now when they get to school, the nurse that's on the bus doesn't come into the school?
The nurse has to hand the student off to the
To
school.
the school
Right.
with the nurse in the
Then
school?
that nurse would go to her position. So and if I have this right,
Yeah, so they're floaters. The ones who ride our buses are what we call float nurses. So after they drop off on a bus run, they'll go cover a clinic if we have another nurse out. The other thing that we've had to cover this year is a midday bus run for a seizure student, because there are students that do leave midday just because of their academic program. So we have to make sure that we have a nurse available midday as well. So if there's a nurse covering a clinic, like GJ Mann, if this nurse gets off the bus at Niagara Falls High School and then goes and covers the clinic at GJ Mann, we also have a nurse available to cover the midday. And we do, in the middle of the day, take students to Niagara University, and we have to have a nurse that can go to Niagara University with the students to attend their programming there.
Right.
So there are a lot of moving pieces.
Very difficult.
I forgot about that. Well, the students are entitled to it. We won't deny students programming. They're in the early college program at Niagara getting their college classes, and that student was a nursing student. We have to put that nurse there. Or she could get off the bus, get in her car, or get dropped off at Mann. Some start very early, too.
We also had a student on the HBCU tour, but in that particular case, the parent came.
Yeah, that's a good point, Mr. Bass. We have an athlete, I'm not going to give the sport or anything, but we have an athlete, a very good athlete who needs this service, and the only way we let this athlete travel to the places they go to is if their parent accompanies them. And sometimes parents just aren't available. I mean, it's really the school's, in my opinion, obligation to provide that service. This is a growing issue. And kids are coming with more fragile medical conditions, and we've got to be prepared. It took quite a bit of coordination to do this. I want to give Becky, Casey, and Mike credit for scheduling it. Maria credit for finding all these nurses and agencies.
And Victoria and Dr.
Dr. Joe and Victoria are involved too. Of course, Dr. Joe and Victoria are involved. Thank you, Maria. I didn't want to leave them out. It is quite a complicated situation. Earl is here. I believe I'm on pesticides. Yeah, this is usual at this time. Maybe we're a little late. Earl has reported that the ticks are out. Earl, take it away.
Yeah, so we do this every year. We spray around the athletic fields. As you're aware, there's, spaces that we don't control just over our fence lines. And so to do our best to keep our staff and our students safe, we spray for ticks. I'm working with the athletic director to find a time where the fields will not be occupied at all so that we can give the proper notice and then the proper wait time.
And we'll post signs, Earl.
Yes, sir.
Board members, if we can pause at 6:07, at resolution 6:07 right now, I want to be respectful of the regulation and posting of the newspaper at 6:30. We'll come back. I'm sure we'll have time once we conclude this next hearing. But if it suits you, Mr. President, we'll stop there. Come back at 6:08, Ray, and do the rest of the resolutions.
Okay, thank you, Mark. So we'll get started. The first public hearing is on the comprehensive district-wide safety plan, correct? Would everyone please stand for the pledge to the flag? I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And we'll have a prayer by Mrs. Dunn, please.
Let us pray. O Lord, holy and gracious Father, thank you for allowing us to see another day. After seeking your guidance, we are here collectively to discuss and approve our yearly budget. It was you and you alone who made our financial plan possible that we will continue to provide good educational programs for all students to learn and be successful in their future. No cuts, no layoffs. For that, God, we give you honor, glory, and praise. Hallelujah. Amen.
Amen. She's getting good.
Wow.
She's good.
Thanks, Clara. Okay, we're gonna start by the overview of Code of Conduct Comprehensive District-Wide Plan. Yes, sir. Oh, I'm sorry. Well, let me finish this. No, that's all right. Roll call. We'll call the roll,
Thank you.
Judy.
Mr. Bass?
Present.
Mr. Bilson?
Present.
Thank you. Mr. Kinsemi is excused. Mr. Capizzi is excused. Mrs. Dunn? Mr. Cadella? I'll mark him excused. Mr. Pareto is excused. Mr. Velardo? And Mr. Petrosi?
Yes.
Thank you.
Thank you. Well, this public hearing is on the overview of Code of Conduct of our comprehensive district-wide school plan and building level school safety plan. Mr. Laurie, this is all yours.
Thank you very much. Briefly, you appointed a committee back in March. The committee consisted, there they are. If you take a look, the committee consists of administrators, teachers, deans, which are teachers as well, parents, students, the Director of Safety, Mr. Del Porto, the Chief of the Niagara Falls Fire Department, Chief Pachaco, and the Superintendent of the Niagara Falls Police Department, Chief Ligamari. The committee was chaired by a teacher on special assignment who has done this task named Thomas Fisher. Thomas works in the office with Rick and Maria. Maria is also the, I entrust her to oversee and make sure that all of the particulars of the regulations and laws are followed. So this committee met, and that's who they are. The committee met in person at Niagara Falls High School. Both plans were completely reviewed. Only minor changes were recommended, and that's because our plan is very comprehensive. There were a few changes. Language was added for the prep schools have an alternative day program, and the development of a district behavioral assessment team, and a threat assessment walkthrough was conducted. What does that mean? Chief Del Porto, Mr. Smeal, Mr. Wooten, and others walked each and every building to identify any threats, anything that we need to correct. All language was reviewed, and we have a district behavioral assessment team to identify students who may be in crisis or have needs. Those were additions to the program. This plan needs to be submitted by July 1st in order to be in compliance. You will not have to vote on the plan this evening. This plan will come to you in June, as Mr. Massaro lined up the dates for you a meeting or two ago. I'm going to talk about something that we may be adding to this down the line and even bringing it back to you one more time before we submit it, but that's to come. Ray, was there any other slides? Maria, did you want to comment at all on anything? Oh, I'm sorry.
That's what I was going to say.
Yeah, language was added to clearly prohibit social media content in any platform on school time. Parenthetically, I want to congratulate the Niagara Falls High School teachers and administration. Since we've come back from the Easter break and the reset, it has been strictly enforced. I'm not saying it's perfect, but it has made a big difference. We will continue that enforcement throughout the remainder of the year and certainly start on it next year. And that we added to the plan that cyberbullying, we have kids that use district team chats to communicate in various ways, and that any cyberbullying across those team chats was added as a violation to the code of conduct. Now, Maria.
I think that the committee did a wonderful job, as you all know, and Mr. Laurie mentioned. This is something that's been in place now for 23 years. And every year the committee just reviews what we have in place and makes the minor changes where necessary.
I do want to foreshadow something, and then we can have comment, Mr. Petrosi. Something that I've asked the high school in particular to do, because we've had a number of speakers since prior to Easter break regarding the safety at Niagara Falls High School. But what I've asked them to do is to develop and show you, first of all, and show the community, a continuum of alternative programs, okay? This is not currently in the Code of Conduct, but they are going to present to you in June a continuum of programs that, I'm sorry for pointing, but it starts with you go to regular school, and then it takes 8 different alternative programs that you would go through, and the criteria and qualifications and the interventions that a student would get if they're not ready or have demonstrated behavior that doesn't meet the code of conduct or what we expect in the school. Mrs. Villardo is going to run across 8 different options, from the least restrictive, which is regular school day, to the most restrictive, which would be individual one-on-one home teaching, and what kind of a student would fall into that category. So for those listening at home, for those who will watch on June 6th, you're going to see a continuum, and I know the board members will need to see this. There will be 8 alternative school programs next year. 8. Some of them are already in place, but there will be 8 alternative school programs. Please don't think of it in the traditional, there's a school over there, they're going to an alternative school. Many of them are nuanced and very different. And she, Mrs. Villardo, will run through them. Board members and community, that is not currently in the Code of Conduct. That is something we may bring this back to you to alter it, but she is still working on that, and it's just not, it's not totally complete to the point where we were ready to present it to the committee. But if need be, we'll bring the committee back. We'll show the entire committee this continuum, and we'll bring this back to you and ask you to add it to the policy with a 30-day wait. I hope that makes sense. God bless you. Thank you, Mr. Petrosi.
Okay. Anything else, Maria? Public comment? Anybody from the audience wish to address us?
Thank you. Thank you very much. Yes, if Ray, you're really spinning the wheels really well over there today, buddy. You're on your game. Let's go to 608, board members. Now, from 608 through 617, these are all payments. None of these are change orders. None of these are change orders. Remember, we're making two payments here. The payments are either from a BOFA, which is the capital project, or ARP, which is the ARP money. And I just will briefly go through, first of all, Earl, whom continues to disappear. He's sneezing? God bless you, Earl. I get a bit lonely when you're not over there. Earl, first of all, has certified that the work has been done and complete to his satisfaction. He recommends the payments to Becky and Richard, who certify him against the dollars we've allocated. Very briefly, board members, Scrufari is working as our general contractor in the capital projects, $168,131. Danforth, which is doing a great job. Scrufari is too. Danforth is working on the air conditioning at Gaskill and LaSalle. We broke this up into two different bids. One is for Gaskill, $536,603.13. 610 LaSalle, $508,696.50. Fry Electric, again, we're very pleased with Fry Electric, $353,780. Stark Technology, which goes away from Earl to Ray. We're putting in all of the cameras, what do you call it, Earl, Ray? What's that one?
Security expert?
Security expert, which is when you leave a door open, the camera and the buzzer. That goes to Ray. That is a payment to Stark of $14,763. Greater Niagara Mechanical, $62,360. That is to replace the boiler at Cataract.
The boilers at Cataract.
The boilers at Cataract. That will be done this summer. Then we move to 614. CIR is doing the electrical work on the ARP. For the auditors that will be listening to this video and for the board members who have to vote, that is a separate funding stream. That is American Rescue Funds, and that is for better air quality in our schools. That is what CIR is working on, and that is $23,344. D.V. Brown is also working on the HVAC at Niagara Falls High School, $147,404. Johnson Controls, again, that's with Earl, setting the controls for the new system at the high school, and the new system at Calfus is $28,955. And finally, when you go to 617, the final payment is for temperature control Johnson Controls Phase 1 of the ARP plan. That's a different, for a different system, $228,947. Why do you see the same vendor into multiple payments? We want to report this by school, by project, by work, and in the case of a BOFA, Richard and Becky have to petition the state to get the reimbursement back, the 98% reimbursement back. That's why we're doing it this way specifically. You might say, why are we doing all these things? So these are a lot of payments. Board members, you have no policies. When you look at future meetings, in June, the meetings are on the 6th and the 20th. They're both Thursdays. The 20th, Ms. Villardo will be here to update you on graduation. And it's hard to believe we're doing this already, but for the 9th time in my superintendency, we are doing the reorganization meeting of July 2nd, as you remember, because we've got seasoned board members here. That's the 80 resolutions that we go through, the reappointments, et cetera, et cetera. Judy gets through the election, takes one day to breathe, and then starts working on 80 or 90 resolutions. And this is my call to that table to start working on your own resolutions, because they have to come, and we want to go through those with you, because the reorganization meeting, board members, is on a Tuesday, July 2nd. It's a Tuesday because the 4th of July is on a Thursday. I particularly don't do anything on the 4th of July, but I know there's a big party at the Petrozzi house, so we can't have a meeting that day. That's what it looks like. On June 6th, that's when Mrs. Velardo will be here to delineate the alternative programs we have for discipline, and we will add a couple of other agenda topics for your knowledge as we move forward. Saying that, if there's questions, I would answer them. You have, a week and a day to ask those questions, to research them, to hear about them. Board members, I don't anticipate any additions. There are no short-term contracts. I don't anticipate any changes. If something comes up that we're not anticipating, I'll be sure to email and call you all immediately with that change. Having said that, I'd ask if Ms. Massaro would return to the microphone. Before she does that, I would like to tell you that I was able to attend 12 Angry Jurors. Ms. Massaro was juror number 7. The acting was worthy of a Golden Globe. Not quite an Academy Award, but a Golden Globe. I will say, I don't know if you remember Mr. David Sanders, who was here a couple of weeks ago. First of all, let me tell you, Mr. Slayman, Maria, you're going to help me here. Mr. Slayman was excellent.
Excellent. Courtney Brandy?
Mr. Wilson was excellent. Courtney Brandy, outstanding. Mr. Vitello's mom was fantastic. Evan Del Porto was student, great. There were 2 other, I think it was Hostler, was she in it?
No, Evelyn Del Porto.
Evelyn Del Porto, Mrs. Del Porto.
Brian Del Porto.
Well, I'll come back to him in a minute.
Carissa Ewing.
Carissa Ewing.
Manny Maya.
Oh, that's Manny, yep.
Yep.
They were great.
And Jack Nadrowski.
And Jack Nadrowski, thank you. I do want to say this, in review of the play, David Sanders was my actor that got the Academy Award. The guy was fantastic. Sorry, Angelo. And I thought Brian Del Porto overacted. Well, maybe next year you'll see somebody else in one of these shows.
We would hope so. We also have to give a shout out to Tom Vitello, Sue Marcolini, the stage crew.
Oh, yeah, it was great, Maria. And did you have fun, Maria?
I had the best time, Mr. Laurie. Thank you for asking.
And was that your real hair?
Most of it, yes. I had some bangs that I clipped in. Mr. Laurie was fascinated with those. I clipped in some bangs, but the rest of it was my real hair.
Yeah, she was quite effusive in her acting ability. You seem to have some talent that you received from your mom. Congratulations.
Thank
Maria,
you very
would you go? No, you want to know something? It was really fun. It was fun to see the teachers in a different role, our staff members in a different role, and anybody who came had a good time. And most importantly, it was well done and a lot of fun. Go ahead.
I just have to say, I can't believe how the dialogue flowed through that whole thing. There was no hesitations. It was really a good job, because there's quite a bit of dialogue in that throughout the whole play.
There really is.
It was all dialogue, in fact, but it flowed very well.
Dennis Wilson and Tom and Sue did a great job. They did a really great job.
Dennis is a pro, right?
He really is.
The
He's
guy's
amazing.
from Broadway. He's
Yeah.
a pro, and Tom's so passionate.
Yeah.
And Sue Marcolini does a lot of the work behind the scenes. She's great. I don't know, Mr. Velardo, but I kind of thought I saw some of the script in front of Ms. Massaro. I'm not sure. I know Mr. Del Porto had the script in front of him. I just thought Ms. Massaro had some of her lines. Okay, I was wrong then. Maria, go ahead. Back to work.
All right, here we go. I do have my script in front of me tonight. So let's start with the certificated staff. This is a great meeting coming up for the board, because this is the meeting where you confer tenure. First off, though, we have our retirements. We have a science teacher at Niagara Falls High School and a pre-K teacher at Blue Bond, and we just want to officially rescind one retirement here for you as well. Moving on to the second page, we have regular substitutes. These are people who, they're being appointed after certification. Now we have your tenure appointments. You see that you have 2 administrators that are achieving tenure, and then you have the rest of the teachers there. And this is a real credit to these folks. They have served a 4-year probationary period, and now, based on their evaluations and Mr. Laurie's recommendation, he's reviewed all of them. He's recommending that they have tenure conferred upon them by you.
And when does tenure officially take place for them?
It becomes effective in September, the first day that they work in the new school year after tenure has been conferred on them. Give you a chance to take a look at those names. Next up after that, you have a leave of absence on page 6 of 16, and then we begin on more per diem work, schedules, B, C, D, E, F, and G. And you're going to continue to see those now through your last meeting or your reorganization meeting in July.
I see you're starting to add, I know you're working with Rick, I see you're starting to add summer work.
Correct. We've been trying to do that so that we do it as Rick is ready to appoint the folks rather than doing it in all one meeting.
Yeah, that's good. And there are some, I'm seeing also on here for those watching, Niagara Falls High School is doing Regents preparation to get kids ready for Regents exams, quite a bit of summer work. We're getting ready for our Walk the World Cultural Fair in September or October.
Chaperones.
Chaperones. We have a lot of trips going on. As a matter of fact, I'll say it now, our LaSalle 8th graders are in Washington, D.C. You know, we talked about this a lot, but today, this morning at 4:30, 2 bus loads of LaSalle students traveled to Washington, D.C. for 3 days. And then Gaskill will do the same, I think, next week.
Yeah.
So my point is there are kids leaving the city to experience the world.
The other thing, Mr. Laurie, as you're pointing them out, is each school is now appointing their SEP teams for next year. So that there's a lot of those appointments that you're seeing here as well.
And the SEPs are directed by Rick. These are the school comprehensive improvement plans. Rick has to have one for every school. Rick also has to lead the district plan, and Rick has to submit them to the state and post them on the website.
Okay, if you have any questions, please feel free to ask now or reach out before next meeting.
Right, you're not voting on these.
Right, not this evening. The classified report is a little bit smaller. We had one resignation of an assistant child care associate. You'll see the majority of the classified report is change of status. So these are folks who have achieved permanent status after a period of probation where they were evaluated by their supervisors a couple times. The evaluations were reviewed by Mr. Laurie, and he's recommending, excuse me, to you this evening that these folks become permanent in their positions. And those go on for quite a bit. And when you get to page 6 of 7, you'll see that there's some additional appointments for Seal of Biliteracy, restorative practice, and some summer work.
A couple things, Maria. Do you anticipate any asterisks?
Only if we do some additional appointments of summer work.
Okay.
Next meeting, which is the 16th, but the June meeting, that's going to be the
June
fiesta.
meeting is going to be a little thicker, Mr. Bass. He just went like this for everybody. That's how long that's how thick that personnel report is. But that's the lead in where I wanted to go next. I wanted to tell the board, we have 5 minutes, but I want you to know where we are with staffing for 24-25. Now, I don't like talking about 24-25 because we got to finish 24. But we have to, Maria, and we all have to get ready. Today, by contract, the election of the deans were held in all of the schools. That is now complete. Yesterday, Maria and I met with the teachers union on any involuntary transfers. These are people who are in a position who may have to move their school. I believe the number is 4 people.
Yeah, there are 4 gen ed, 1 special ed.
4 general ed teachers and 4 elementary teachers and 1 special ed teacher. Because of class size shifts, we have to involuntarily transfer them. Maria will show them a plethora of openings, and they get to pick in order of seniority. There's 5 names, 1 in special ed here, 4 over here. That's all. Maria also has a list by contract of those staff members who indicated by May 1st that they voluntarily would like to change schools. It's not a tremendously long list. It's mainly elementary. There's just fewer than a handful of secondary people on there. But once Maria works with the principals and does that voluntary-involuntary move and slots everybody by contract, she and I will sit down, call the principals, and say, here are the voluntary if we can do that. My philosophy and belief is, if there's a teacher who would like to move for whatever reason and we can accommodate them, and there's nothing that, I see a problem with or the principal does, I like to let people work where they want to work. They do, but ultimately it's my decision to recommend to you. Yes, ultimately. And yes, it is, Nick and Mr. Velardo. And you know what? The principals have been pretty good at that, And they're very honest if they say, and this doesn't happen, I've had a problem here. Maybe I'm not the best person to. That's the feedback they give me, and I listen to them.
Yeah, most times people don't want to hold anybody back from
No,
going different places.
it's
Just
rare.
like that where,
It's
this
rare.
pretty much happens all the
It's
time.
rare.
Yeah.
However, if there's an issue, I will listen to it. I say that to you because once that is done, bless you again, once that is done, then what's going to happen for your June thick packet is I am going to work with Maria. Well, Maria's going to do the bulk of the work. I just come in at the end. She's going to call the principals and say, you have a 3rd grade opening. Here, who do you want? Who do you want? 19 out of 20 times, I'm going to go along with the principal. The 20th time may be that they don't know the people, and I want to say, you know what, you don't have any openings, but this person has been a dynamo at Cataract. I want that dynamo to have a job. You won't be disappointed. Call Mrs. Manella and find out about him or her. My goal by June 20th is to have that thick report that Mr. Bass illustrated filled with almost every single position by June 20th. That's going to take a lot of work, and that's what we'll be doing for the next month after I have my first vacation. So that's coming up. You're going to see it is my first day off. You're going to see a thick packet, but that's where we are. Last comment, and I know we're getting close to 7. Maria and I sat with the high school on Monday. I have to tell you, the high school staff right now, with the exception of maybe 3 or 4 teachers,
Maybe, yeah,
is ready to go.
ready to go.
We're ready to go at the high school, sans 3 or 4 teachers. Really, and let me tell you what those are. There is a social studies openings there, and guess what? Mrs. Velardo and team will have their choice of they have to fill 2 positions, and we have 4 candidates. Mrs. Velardo is going to, well, she's going to ultimately recommend to Maria, to me. She'll be able to pick who she wants. There is another discipline where that's the same thing. I can't remember.
Special education.
Special education. We have some candidates. Mrs. Velardo is going to follow her process, tell Ms. Massaro what it is. She'll pick and recommend the candidates. In the spirit of being completely transparent and honest, there are 2 areas that are not filled. One is 1 second language teacher. It is no secret. We are having difficulty finding second language teachers, as are the rest of the Western New York. And the second one, I believe, is a school psychologist.
Correct.
But Ms. Massaro is working on that. As we sit here on May 8th, my daughter's 29th birthday, Thank you. I would say we could open school tomorrow for next year with needing 2 positions. Now, things will change over the summer, but that school psychologist, which Maria is really working on, and the second language teacher. I have to say this about second language. I watch the news, and I'm watching a college, I'll say it, it's Fredonia. And Fredonia is cutting 13 programs. And I'm not trying to lay the Fredonia out there. One of the programs that Fredonia is cutting is world languages. So where do we get our world language? Where would we get a new world language teacher possibly from? Fredonia. They're cutting the program. So I thought it was a real positive meeting at the high school. They know what they're doing. If it was September 7th, 2025, and it was the first day of school, except for a second language teacher and a psychologist, we're ready to go.
I know we're getting close to it,
Yeah.
after 7, but I
Go
have
ahead.
just one question. How are we fixed for subs and regular subs?
We'll have enough regular subs to plug in. Beyond that, I
That
can't
day-to-day,
answer.
we're not,
I can't answer that, Maria.
Per diem is going to depend on a lot of things. So far this week, I have 70, believe it or not, interviews scheduled, and I'm sort of halfway through them. And there are teachers out there. The point is, I've told every single person that I've spoken to, if you don't have your dream job, if you don't have your dream probationary appointment, you have a spot here if you want to substitute on a day-to-day basis. So the offer is out there. If they get hired, great. If they don't, they can come here and sub for us. So we'll see where that takes us.
They're out there, though. Did you say 70?
70.
70.
Yeah.
It's a lot. Now, the tricky part of it is, we got to get them to come and sub here. Maria's working.
They're both. They're teachers they're folks who are moving back to Western New York from other places. They're people who are just graduating from school, and they're folks who may have lost a position in another district.
We just met with Niagara's candidate pool. Maria and I do a little song and dance, and I do the overview of the district. Maria does the technical side of the district, and there was got to be 50, 60 people.
Yeah.
50,
So
50,
yeah.
These are Niagara graduates, undergraduate and graduate. Now, I don't know if there was a second language or a psychologist among them, those folks. I can't say that there was. So the moral of the story is we're in decent shape. I think I've said this year after year. Psychologists and second language continue to give us some pause. And that's the honest to God's truth. I think we could staff the school district tomorrow, except for those 2 positions.
Anything else, colleagues?
Good.
Mark?
Thank you.
No, thank you, sir.
Okay, let's move into the public hearing for our budget. Judy, call the roll, please.
Mr. Bass?
Present.
Mr. Wilson?
Present.
Mr. Kinsemi is excused. Mr. Capizzi is excused. Mrs. Dunn? Mr. Cadella is excused. Mr. Pareto is excused. Mr. Velardo? Mr. Petrosi?
Here.
5 present.
Thank you. Mr. Laurie, you're up again.
Thank you very much. This is our hearing, and we'll say it and say it and say it. We've got the 2 best. There is. Julie and Becky, we're glad that you're back. They're right on top of things. Mrs. Dunn alluded to it in her beautiful prayer. We are presenting to the public a budget that does not have any reductions in programming and no reductions in force. I have and will continue to heed the call of the board that anytime we have a vacancy, we are studying the position to determine the absolute need for students. There have been some small decisions made on that. I say that because I believe you guys and gals, that's a bad way to say it. I believe the board members did a great job. The problem is that this budget gap of $6.3 million that you're allowing us to use reserve for doesn't look like it's going to go away in the future. And it is going to be very difficult to keep making that same ask. So in order to try to get ahead of it, we continue to really look at every position as they become vacant, so a live body, a live citizen, a live employee, a live person who contributes doesn't lose his or her job. But Becky and Julie did a beautiful job on the budget. It's should be very familiar to you, and I'll let them take you through it very smartly.
Okay, thank you, and we are here to present the 24-25 general fund budget. This is a familiar format to you. It's the same one we've been using in recent years. So if we'll go to the first slide. As you can see, we start with the tax levy history. Our tax levy was stable for many years, and it was raised slightly in 2014 and has remained stable since that date. Our tax levy is at $25,828,989, and there is no increase proposed again for this year. The only way it's been able to stay stable as it is because of the decisions made at this table. And there's a little history, 3-year history of the budget. As you can see, we are proposing an increase next year of $9,487,841, and that would give us an operating budget of $190,992,49. It's a 5.23% increase, and the consumer price index right now is hovering around 3.61. At the time of the governor's budget, it was at 4.1%. This is a comparison of the current year's budget and the proposed budget. We'll start with the revenues. If you look property taxes, we're advocating for a small increase in the budget, and it's not that the levy's increasing, it's just the way that the payments are being made. It's the trend of, the timeliness of the payments. Overall, for local revenues, we are expecting a small increase, and that includes tax on consumer utility bills and pilots payments in lieu of taxes. We expect to remain stable. I'm sorry, can you go back? State aid is the biggest revenue source for us. The foundation aid is the one the superintendent has spoken about frequently. It's our biggest funding source, where the foundation aid increase was minimal compared to what we were anticipating or what we felt it should have been based on the state's formula. And we are seeing an increase, but again, not to the point that we feel we should be seeing an increase in. BOCES aid, that's a reimbursable aid. We are not spending as much in BOCES as we did in prior years, so next year our revenue will go down in that area. Other aids are all fluctuating at various levels. Transportation aid increases, building aid increases slightly, excess costs overall increases slightly. Charter school will go down a little bit. Basic tuition aid slightly decreases, as do hardware, software, textbook aids. Those are all formula-based aids or reimbursable aids. Miscellaneous revenues, we're going to see an increase in that area. It's mostly due to the use, our proposed increase of use of Greenway funds. Those were monies that were awarded to us for specific use. We chose not to use them in the prior year, but we're using 2 years worth of Greenway funding in this current year. Other than that, we plan to make up the difference between revenues and expenses by allocating reserves and fund balance. If you look at revenues as a percentage, and a good visual is the pie chart, miscellaneous revenues make up just over 2%. The fund balance and reserves make up just over 3%. Local revenues are about 15%. State aid is the biggest source of revenue, and it's just over 79%. Some of the highlights again of our revenues: state aid increased, the foundation aid about 2.1 million at the time the budget was adopted. We do anticipate a larger increase than that, closer to about 3 million. BOCES aid, we're expecting a decrease of about 1.5 million. We're using $840,000 of our Greenway revenues. Our use of reserves is 4.5 million overall, 750,000 of debt service reserve, 750,000 workers' comp, and $1 million each of 3 other reserves being ERS, TRS, and employee benefit reserve.
I want to give the board and the community a little bit of good news here. It is an exorbitant amount of reserves we're using. However, today, Becky and Julie are constantly analyzing our budget. And there will be a small amount saved from this year. And what I was really happy to see is that this year's expected revenues are exceeding what we thought. So we're getting more money from various sources than we budgeted for. Now, we can't use it, but what we can do is plug that into this use of reserves to start to grow it back again. And we received our final casino check yesterday, which is good. We never count on that. It's our final one until we know what's going to happen with 99H, and we don't know. But that was good news. We got the money. We didn't count for it. There are some voluntary pilots that we have received money in. There is some additional revenue that has come to us because of very good investment work by these 2 young ladies. And finally, I think it is our utility tax.
Yes.
We are receiving more utility tax than we had budgeted, which is good news too. So those 4 areas, sorry to interrupt you, but I did want to give the public and the budget, first of all, the board thanks for trusting, but also know there is some good news on the horizon. Is there good news in order to replenish everything? I don't think it's that good. But your trust to say use the reserve, save programs, save jobs, save programs, I think very strongly when Drescher and Malecki comes here in November that you're not going to need to use as much as we thought. But we can't build a budget that way. I'm sorry if I overstepped with that comment.
No, that's
Go ahead,
very, very well said.
Question, good to see you back again. The utility tax, is that just a formula that's determined independently and we just collect it, or we don't
Yes.
have, okay.
Mm-hmm. Yeah, we have no control over that tax. It's the tax on your cell phone bill and things like that.
But we did well.
Mm-hmm.
We budgeted at a traditional number, Mr. Bass and everyone, and we, for whatever reason beyond our control, we exceeded that number. So we didn't build that into this year's budget. We're going to have additional revenues. We can't do anything with it now except put it, when it's audited, put it back into our reserves.
Actually, if I can make a comment on that, it's a percentage. Like cell phones are 2%, I believe, 1.5%, 3%. And the natural gas, it's on your national fuel bill. So it's actually based on what the consumer is paying. So.
Yeah, I understand. I just didn't know how it was determined.
Determined on usage. The community usage is what the bottom line is. Did we ever look into water? There could be a tax on water?
If there should be, or if
Is it possible?
that, I don't know. We could look into
Because it's
that.
not a city water, it's not city water anymore, it's a
Separate entity.
separate entity.
Okay, we can check into that.
Just a thought.
Okay.
Thanks.
I have one question too. We haven't, haven't talked about it in a long time, and I can't remember the exact title for it. But weren't we were selling electricity back from when we had that deal with the power authority? Is that shown in any revenue? Or where's
Oh,
that
yeah,
shown?
that, we
Are
still
we-
do that, yes. It doesn't always generate revenue. Sometimes it's an expense, but
Yeah.
it's a whole,
Different ballgame?
yes, yeah.
Right.
that's,
Earl, Earl's very good at that. It's a compliment.
Well, thank you. I don't recognize it. Yeah, Rebecca's correct. So what we do is we sell it back, and then we buy at our rate the energy that we use. Where it gets sticky and where it gets, like Rebecca's referring to, kind of complicated is depending on the cost of natural gas and when the electricity is needed from the NISO, the grid, determines whether or not that ends up being a net revenue or a net cost to the district.
Well, it depends what they're selling for at the time, correct?
That's correct. The long and short is,
But our rate is fixed,
our rate is fixed.
but the other rates are variable, so if it's above or below, then we're losing.
Exactly,
Gaining or losing, yeah.
yeah.
Okay.
And what Earl and Becky and Julie keep reminding me of is we're putting air conditioning in 2 more big old schools. Now, again, I wish I could tell those 2 schools, LaSalle and Gaskill, that it would be up and ready for September. It won't be. And it's not because of any other reason than the shipping time of electrical supplies, but our expectation, and you'll hear this during the capital projects, our expectation is they may be able to end next year with it, but that would be just a short amount of usage, correct?
Right, so our hopes are that we'll have those systems functional around spring break of next year. That's our hopes.
End of April.
Yeah, so it will only impact this year's budget by a couple of months. This upcoming year's budget, excuse me.
Just another question. On going back to our, I think it's 5 megawatts we get from the power, from NIPA.
Please don't hold me to this, it's been years. I believe it's 8.2 megawatts, Ross.
Okay, I just happened to, 5 sticks in my mind. Will we have enough of that power, that low-cost power, 2.5 cents, Earl, if I remember correctly? 2 cents?
The energy rate is a little bit less than that currently.
Will we have enough of that power to power the 2 new buildings?
I cannot answer that question tonight. I will have to dig down
I'm
and
just
get some
curious.
information. It will be very close. What I'm really hoping for the district is what I'm seeing already with the new chiller plant at the high school. We're going to see such a dramatic reduction in consumption at Niagara Falls High School with that chiller plant. We'll hopefully be able to offset a good portion of LaSalle Prep and Gaskills.
That's good news.
Yeah, look at, that chiller plant that's going into the high school is top-notch. Do you still feel that way, Earl?
It's amazing. I can get all geeky about it if you want me to.
No,
but
please don't.
Nobody else wants.
Please, we all vote no. Don't get geeky, don't get schmaltzy, don't zhizh it up, as somebody over there says. Just try and stay calm about it. Yeah. But you're real happy with it. I know we're getting off target, but you're real happy.
Right. We're running out the what you might say the little startup things, cleaning out the system, stuff like that over the next few days. But already what I'm seeing, I was in the high school the day before yesterday when it was rather warm out, and the entire high school was being chilled by 2 of the chillers on a 70-some degree day to the order of about 150 kilowatt hours. Just one section of our old chiller would have run at about 350 kilowatts. So every hour, 350 kilowatts now is 150 kilowatts. That's a dramatic reduction.
And Mr. Bass said it earlier, they're doing a really good job with that system, and it's going in really well without any problems.
That's correct. Just your typical kind of startup stuff that we're dealing with, and it's coming together nicely.
Sorry, ladies.
That's
No,
fine.
Rebecca, proceed.
It's good conversation. And again, I'm just going to end this slide by saying we're going to use $1.8 million of our unrestricted fund balance, but as the superintendent alluded to, we hope to be able to replenish that at the end of this year.
I am very confident that that 1.8 will be replenished. But we cannot budget that way on my confidence. But from what I'm seeing, mainly in additional revenues and some good savings of not spending this year, we're going to come, I think we're going to replace the 1.8 million.
And state mandates that we show the budget in this three-part format. The three parts are administrative, capital, and program. Of course, administrative is the largest spending area. Program is the largest spending area. That's out of the $190 million budget, we'll be spending $132,636,946 on the program side. Capital includes all of our maintenance and grounds work, and it includes our debt service payments, which my predecessor always explained it as the mortgage payment. So those mortgage payments are included in the capital portion, and that total spending is just over $35 million. The administrative portion is everything else. It's not only administrators, but it's all support staff and contracts and spending of that nature, and that's just over $23 million. This is the three-part budget in a pie chart, and again, program is 70%, administrative is 12%, and capital's at 18%. That's pretty standard year over year. Now, our expected expenditures by type of expenditure, because we're a service industry, salaries and wages and benefits make up the bulk of our spending. Salaries and wages are just over $78 million, or about 41%. Benefits are right behind that at just over $42 million and makes up just over 22%. Below that then is our debt service, which are our mortgage payments for all of our properties and maintaining our buildings. Transportation, then followed by tuitions, is at 7.21%. We spend about $13 million there. BOCES services, that's all of our BOCES contracts, a lot of our technology, some of our special needs tuitions, all run through BOCES. Our overall spending with BOCES is just shy of $15 million. Makes up just under 8% of our spending. And the other category is all the other contracts, our insurance, and by insurance I mean like our general liability insurance, not health insurance. But that's supplies, miscellaneous spending, and that's an overview of the expenditures in those categories.
Question. Insurance compensation is in there?
A workers' compensation, yes, it is.
Okay.
Expenditures by type, again, it's everything you saw on the previous slide, and it just is, again, in a pie chart, which is a really nice visual, and it shows you the percentages associated. Some of the highlights on the expenditures: salaries, and we're increasing approximately $4.6 million. That's for all bargaining units, and it's based on contractual increases. Healthcare, we're seeing a bigger spike in healthcare prices this upcoming year than we have seen in several recent years.
Remember we told that 9.5%, remember in that? That's a bigger increase. Remember, please, all 6 units have contracts through 27, 28. This is a big year contractually, and I know it compounds, but the healthcare bump of 9.5 really caught me a little bit by surprise. I know I probably should have anticipated. That's been the biggest jump we've seen in a long time.
It did. And our debt service, we did budget $750,000 for interest, because we will borrow to help support our outflow of cash for the capital project will ban. Do a bond anticipation note. Transportation contracts, we don't have the exact increase, but we estimated 800,000 at about 3%. The CPI for transportation contracts is not publicized until the end of May.
3% is a very fair number, though.
I believe it is. It's been about that over the last several years.
It's not going to be zero like it's been a long time ago. It's not going to be 4.1%. I think 3% is, we'll get you the actual number. We have some flexibility in there, but I think 3% is good. I'll talk about transportation when I come to another slide. Go ahead, Beck.
In tuitions, we do anticipate an increase in costs of about 1.5 million. That's including charter schools and special needs out-of-district placements. Contractual increases in general are going up anywhere from 3 to 13%. The 13% is our general liability insurance coverage.
Property liability insurance. That is very high. Again, it's my assumption that that is because of child victims cases. Going forward, 13%, like 9.5% is something that we've never seen before. And in that tuitions line, and of course I don't begrudge the individual in any way, but you remember we brought a resolution to you in March of one student who cost $210,000, if you remember that resolution. So it's very, very high for our out-of-district payments. Thank you.
Okay. And now if the budget has to pass by a 60% plurality. That is due to the fact that we had a negative tax cap calculation. We are not asking to raise the levy, but because of that tax cap calculation, we do need 60% majority. If the budget is defeated and we operate under a contingent budget, the tax levy that we're going to collect next year still is going to remain at the 25 million. It's not going to decrease. What will decrease is our ability to service students in the community with a lot of high needs. We won't be able to buy supplies that students should reasonably be able to bring for themselves. Transportation would be limited to 1.5 miles minimum. So that would mean the elementary students that we now bus at 1 mile, we would not be able to. That has to be increased to 1.5 miles. We would not be able to purchase equipment, which in next year's budget, we have minimal equipment budgeted, but we still would not be able to purchase any equipment that's needed during the year. That line would have to go away. And the biggest thing that would impact the community is for any community use of our school buildings or facilities, we would have to charge the community members up front for the full cost of the use of that facility or that, the grounds that they were using.
So let's talk about this for a minute. And I'm not telling anyone how to vote, but I want everyone to realize a couple of things. 60% plurality. It's a bad law because we have no tax cap change. We have no tax. It's still at 60%. Number one. Number two, at 5:30, Jamie, Kevin, and Stacy talked about student supplies and all the things they did. Some of these are basic supplies. That would end. Number three, I told you this, and we have parents in very unique and interesting situations. I get calls daily. You live 1.5 miles or fewer than 1.5 miles, you cannot get a bus. I might appreciate your situation. I might commiserate with your situation. I might think I could do it. I can't legally do it. And there's no secret, because I've told board members before, a parent can make an appeal to me, and I have waived that. There are very extenuating circumstances in this city where kids need buses fewer than a mile and a half. That can't happen. Equipment, as Becky said, or Rebecca said, is limited. We're not buying a lot of equipment next year. But you know that you can go this weekend and every weekend through July, to either the sports complex or the theater, and you will see community groups using that. We have to charge you, and you have to pay upfront the full price if the budget fails. So I don't happen to agree with those rules, but those are the rules. And I just want to make sure it's as a good friend of mine who is wearing the same colored suit, interestingly, in a very good show of solidarity and admiration, always tells me, I'm just punctuating for the community that this is what will happen. But the voters have to vote their conscience. But you should know what you're voting on and not voting on. You may not like me, I understand that. It won't change my salary. It won't lower your taxes. Those are just facts. Those aren't ways to tell you how to vote.
And we also don't have the right to raise taxes after the vote without a vote. I know that was a point of contention before, that an individual didn't like the wording, making it seem that we had the right to change the tax levy afterward. I'm like, that's not how this works. Yet they refuse, because that's just how their brain functions.
Right. It happens. It's going to happen. Mr. Bass is right. We can't do that.
Right.
We can't do that.
And state law says under a contingent budget, your levy cannot be higher than the previous years, but we're not recommending an increase to the levy anyway, so there would be no change.
I challenge you to go to any of the 37 Western New York districts and find more than 3 that are keeping their tax levy 0. Some are increasing 1%, some are increasing 3.89%.
And we've done that, we've only raised once in the last 20 years.
2014.
It was the last time it was the last percentage, so
That's
we
right.
held the line for 25%.
Once in 25 years, and then 2014 was prior to ML here. I'm just throwing that in here.
Yeah.
PML, prior to ML. Okay, back.
We'll go in.
Yeah. Oh, you're good.
Go ahead. Oh, okay. This is the contingent budget laid out in that 3-part format. Again, administrative, program, and capital. As you can see, the center column is the proposed budget. The far right is the contingent budget. It really does not change too much of anything as far as our spending goes. It's a minor decrease in spending of just over $250,000. And what is impacted, again, is our ability to service our students and community. This is the property tax report card. This is something that we put before you when you adopted the budget. And this was sent to the State Education Department. It's in the budget notice and the budget book. Shows the proposed budget, shows the levy and the percentage of change, again, 0% for the levy. Shows the column, the rows F through I show basically the calculation on the tax cap, which is why we need the supermajority vote. And then down below, it just shows the actual fund balance and reserve balances as they are today and where we estimate them to be next year. And again, this is the second page of the property tax report card. It just shows the balance in those reserves at the moment. And you can see the reserve for debt, that we expect that reserve to go down by $750,000 by June 30th because we did plan to use that in this year's budget. And then again, these are our other reserves. If you can see the actual balance on March 31st and what we anticipate on June 30th are the same amounts because we were not using any other reserves in the current budget. This is the budget notice. You've probably received it in your homes, and you'll probably get another postcard about this. Again, it shows the proposed budget. It also shows the contingency, and it shows the difference between the two. It also shows the proposed tax levy to fund both the budget as proposed and contingent, and it shows that they are the same. Again, it breaks down the plan spending by the three-part format as dictated by state law. The second page of the budget notice just shows you the estimated average saving for the STAR program. The average homeowner can expect to save $363 on their school tax bill. This is important to note that even though our transportation contracts, when we do these contracts, are multi-year contracts, the amount shown in the proposed budget reflects the spending for the 24-25 school year only.
Right. So just to be clear, in October, the bus contracts run out next June 30th, 2025. Niagara Falls Coastlines. In September, we're going to talk to you about this. In October, we're going to submit an RFP. And hopefully in November or December, we're going to ask you to award new bus contracts. So we'll conclude the Niagara Falls Coastlines. This will be an open bid. We're having an outside consultant work with us to prepare the bid, to put the bus contracts out for bid. But I know, Mr. Petrosi, we've talked about this. We want this done early. I want to bring this before you by December at the latest, because we'll need that much time. So information to you in September, RFP out in October, adjudication of the bids in November. If we can get it to you in November, we'll do it then. If not, we'll get it to you in December. You'll have to vote on a new bus contract. That's foreshadowing, but Becky says this only reflects the budget on transportation we're spending next year. This is a required part of this presentation.
It is. And another required part of the presentation is a tax exemption impact report. This is provided to us by the city, by the assessor's office, and it just shows the total value of exemptions by category for the properties within the school district. It's a 2-page report. If you go on, yes. Mm-hmm. Yes. When you go to the polls, you're only going to be voting on one proposition and 2 board seats. The budget proposition will read, ask you if the Board of Education of the City School District of the City of Niagara Falls can be authorized to expend the sums set forth in the proposed 24-25 budget in the total amount of $190,992,049 and to levy the necessary tax. The voting is May 21st. We do ask that everyone get out to vote. I encourage your neighbors. Tell them where to find the information. It's on the website. It's in the district clerk's office. All the school buildings have the information. And we just ask that informed voters come out and vote their conscience, because informed voters are all we can ask for. So again, you can contact Judy Glasser. And are there any questions?
Couple comments.
Sure.
First of all, 6 million or 6.2, whatever the number is a big number. It translates to 60 jobs, 10 jobs per $1 million, round numbers.
Oh, right, yeah.
Right. the reason we were able not to have to cut those jobs is because of reserves that were saved for a rainy day. And also for something that I think a lot of people don't understand. This district had the wherewithal to match one-shot expenses with one-shot revenues, ARP money, where everybody else just put it into salaries.
It's a great point, Russ. I'm sorry.
You know, we used our own money. We brought the salaries back into our budget. That's why everybody else is going crazy. And the districts with a third of our budgets are 6 million in the hole.
You're so right, and I want to boast to the board. First of all, yeah, we figure it's about 60 jobs. 6 million is 10 jobs. It's about 60 jobs. That's what would have had to been cut just to cut jobs, 60, to not use the reserves. And that doesn't even mention programs that might have had to go along with it. Secondly, I was asked this question by a television station who said, how did you do that? And I said, because the board insisted that we stepped out of ARP year by year. So let's think of 3 years of ARP. In year 1, we did have some salaries in there. In year 2, we stepped out a big amount of them. In year 3, we stepped out all of the rest of them and used all of the money for one-shots. What are one-shots? A lot of staff development, a lot of other training, and a lot of capital projects money that once you put in the heating and cooling at Niagara Falls High School, Bond, and Kelfis for better air quality, you don't have to pay it again. So it was a step down, and I think people are saying, how did that board do it? That's how you did it, because I remember saying, get those salaries out of there. You let them stay for year 1, but you didn't let them stay for, now year 2 we had a few, but year 3 we had none. So we stepped out of them as if we didn't have the money in the 3rd year of ARP. And that's the way the board designed it. And in the last year of it, what are the resolutions? The resolutions are paying for one-shots. They're paying for, Rick will tell you, they're paying for a lot of summer school stuff this year. Now, that does beg a question. You know, we have to talk about how we do summer school and summer programs next year. But we'll figure that out. I have some ideas. We have some things that are going to be good ways to do it. But it's such a good point, Russ, that we were talking about ARP 2 years ago and how to get out of it. I appreciate that.
Anybody else? Any other comments? Saying that, motion to adjourn?
I would like to do it. Can I make 5 comments?
Sure you may.
Thank you. I'll be brief. First of all, I see Mr. Barksdale. God bless you. We have a lot of sneezing going on. I'm getting worried. Everybody needs to be at work tomorrow who sneezed. Please, what is going on with the sneezing? Earl, take off if you want. We need everybody else. Mr. Barksdale's here. The board has submitted their comments. We're putting together his responses. We're just about done. You haven't had a chance to meet. A couple of other board members still need to give me their comment. Well, they need to clean up. We need to collate their comments. And that by Friday or Monday, we'll have that response back to you, Mr. Barksdale. Thank you for the extra time. But I collected all the comments from the board, and I just received comments on 2 of the questions that I need to finish, and then that will be done. This was the first time they were all together to give me their answers and putting it together on the fly here. That's number 1. Number 2, I'd like to talk about a play that Maria wasn't in. It was done in elementary. It was The Lion King Jr. by the Abbott students. It was phenomenal. The Lion King Jr. aired twice. I think they did a 2 o'clock show for the kids and a 6 o'clock show for the community. I want to congratulate the Abbott teachers who did it. It's great that we have drama programs, theater programs, and performances in elementary school. Maria, you weren't asked to be in that? I was not, but I fully supported. Okay. Just wondering. Number 3. Great dinner last week at Antonio's by the Niagara Falls Education Foundation. Many of the board members were there, along with 204 other people. I know Judy did a great job helping to coordinate it. 23 students received scholarships, and I said when I made my remarks, it is a darn shame when we write about 2 or 3 or 12 other kids that they don't see 23, this is only one scholarship dinner, 23 kids, marine biologist, engineer, on and on and on and on and on and on. Unbelievable Niagara Falls High School students, unbelievable colleges and vocations that they're going to. Congratulations to the foundation. Saturday was a day of cleanup in the city, and the teachers and others cleaned up around their schools. We had a cleanup group here, which we appreciated, but our friends at the chapel worked at Cataract. They built, and you have to go behind it to see it, by the Ralph Wilson Dome, they actually built an outdoor classroom with benches. They're going to have a dry erase board outside so kids could go outside and study, and 25 kids can go outside and work in comfort at the classroom when the weather's nice. They built it for free. The chapel built it for free. The group did that. I want to thank them. In addition to that, 26 Cataract families received service to their car, not just interior and exterior cleaning, but if you needed oil, fluids, 26 Cataract families got car service by the chapel people. Thank you. My final comment tonight, I have to address this, and I just read this, and I feel that I accept the fact that we need to always improve, and we're not there. But now, this is 2 weeks in a row that I've read in the paper information that is utterly, completely, and totally incorrect. And the message goes on and on and on. So tonight, next Thursday, and every chance, I have to correct this. It continues to say that only 19% of our 3rd, 4th, and 5th graders can read. That is a complete and utter falsehood. When you use one measure that is not intended to track grade level and say 81% of the kids can't read, it is so far removed from the New York State Education Department philosophy and everything we know, and yet it keeps getting reported here. Because a student gets 3 or 4 on a state test does not mean he or she can read, and if you get a 1 or 2 does not mean you can't read. There are many students who receive 2s on that test that can read. My daughter, and I'll bring her report card, I'll bring her tests next week. She got 2s. At that time, she can read. That is not what those numbers mean. They don't mean you can or can't. This is not a grade level reading test. This is a program test, a status test, and on top of that, when I go to the doctor and the doctor is checking my heart, he, or in this case it's a he, the heart doctor, he doesn't just put a stethoscope to my heart and check with the stethoscope. He makes me go through a battery of tests and gets multiple measures. It's really bothering me because I feel bad for the kids and the parents who are saying, my kid got a 2, but they can read, but they're telling us they can't. It's not right. It's not right. Now, there is no better curriculum person in the state than Rick Carella. If I was wrong, Rick, you could tell me. I know that we have kids who are scoring a 2, and I know that you have been in Albany, where you have good friends that will tell you that that doesn't mean you can read and you can't read. And before I ask you to comment, we live in a district. Education is built on a scaffolded set of steps that ultimately gets you to graduation where you can perform at a proficiency level. If we don't acknowledge that every one of our kids is different and at a different level, then we're sadly mistaken and we're not treating our kids fairly. Some kids hit it at this point, some kids hit it. My daughter hit it at a different point. My oldest son, who is very difficult, could read in kindergarten. But that doesn't mean because he got a 3 on the test, he could read better than my daughter that got a 2. It's just false narrative. And you can see the frustration because the poor parents that are reading and hearing this incorrect information are saying, but Mr. Lawyer, my kid can read and I have a 2. What does that mean? Why would they say that about me? Why do they? Now, are there kids in that group that are having trouble? Of course there are. But it's got to stop. And I am going to use the next couple of bully pulpits to continue to make sure people understand, with Rick's help, what that really is. And on top of that, I hope that you would agree that when you go to your doctor and they use their stethoscope on your heart, you don't just let them do that. I hope they give you a stress test. I hope they give you whatever test you get, and then make an assessment about your heart. Because if they just check my heart with a stethoscope, they could see it's racing very hard right now. And I don't, God forbid, please God, I don't have heart problems, but they'd find that it's moving very hard. They wouldn't say I have cardiac problems right now. They would take this, that, and other things. And my doctor takes a compilation of all of those things and makes an evaluation of my heart. Some of it's probably, yeah, I could stand to lose weight. That would make my heart work better. The parents that I'm getting are saying, why would they write that way? And it's the second article in 3 weeks. One was the investigative report, and one was today's count. It's so incorrect. And believe me, I am the most prideful person about the kids in this district. I hope you know that. 40 years, moving to 41 years, 3 kids through the district. I know you know how I feel about kids. I just can't let the kids keep hearing this. Rick, when you talk to the people in the state in a much calmer way, can you explain, and one more thing before Rick talks, people. The state's going to change that because this is the message that they're getting. The state is going to change that because this is the message that they're hearing. The state realizes it's not the way it's supposed to be used, and people are using it to bash school districts. Bring your heart down, Mark, and turn it over to Rick.
Well, you are correct. It's a system that we've had since the late 1990s, when the federal government first mandated assessments that we typically refer to now as state assessments. They haven't changed the reporting system since it was initiated, and I believe the first year was 1998. I was a 4th grade teacher at that time. They are working currently on revamping the system because the results as published are consistently misinterpreted and misreported. A student who is a level 2 and a student who is a level 3 are not in 2 clean buckets, meaning one can read and the other cannot read. That is ridiculous. The kids are all along a continuum of proficiency. Those are just 4 categories. Within each category, there's a wide range of student abilities. And when you're talking about the cusp between one category and the next, a student taking a test on any given year can answer 1 or 2 questions correctly or incorrectly and wind up in a different category. So they are very well aware of the fact that it misrepresents student proficiency, so they're working on a better system. The bigger picture is that those levels also can lead to schools and districts being cited as potentially ineffective or in need of improvement when in fact they may be doing all the right things to serve their student population. So it also is not a good characterization of school districts, their efforts, their curriculum, and so on.
Thanks for being calm. It's just not right. It's not right. And guess what? Do we have work to do? A ton. A ton. Do we have kids needing support services? A ton. Are we perfect? Far from it. My God, far from it. But gosh, please, make sure you're accurate when you're speaking, because it's an affront to our kids. And say, 81% can't read. That is such an affront to them. It's not. I would love to have, is it Jason Harmon? I would love to bring Jason Harmon here, the person at State Ed, who Rick has a very good relationship, and I know him, to explain that. Because they're going to say, that's Mark Laurie defending his bad scores. That's not, it's just, I can't go on another state webinar and listen to the commissioner and Jason telling me this and not say it. I just can't. And then I got to get an article 2 weeks ago and an article today, and I just can't let it go. I can't let it go. And I am not going to let it go. I'm going to make sure that where I failed is that I have not done a proper job of explaining what that means. And I vow to you that I will do a much better job explaining, along with my colleague, what that means and how that is really a very, very inaccurate and very poor reporting. Very poor reporting. It's nothing personal. It's just very poor work. Because if they would have asked me, I would have first said, talk to Rick, but I would have given them a much different answer. Sorry, I'm calm, I feel good, but I care about our kids too much, and I care about our parents and community too much to let that go 2 weeks in a row and read that, and it's just wrong. It's wrong. I'm not always right, but I try. I'm not always right. I try hard to be accurate. So, hey, thank you very much, board members.
Thank you. Public comment. Anybody from the audience wish to address us on the budget? Saying no, that'll take care of that. Anybody else comments? No. Nice job, everybody. Nice presentations. We appreciate it. We got a lot going on, a lot of good stuff.
Yep, next Thursday. Our next meeting is back to Thursday.
Back to Thursday next week?
And then
the Wednesday after that.
Right, the following week is a Wednesday, 8 o'clock meeting only, just to certify.
And that'll be 10 minutes.
It should be 10 minutes.
10 minutes. Okay.
And I will not be here, but Judy will do a great job.
Could we have a motion to adjourn? Nick, Earl, all in favor? Good night. Good night, everybody.
Judy, you're sitting here that night. You got my seat that night.
All right.
Thanks for inviting me.